as I rise up is count my blessings. First thing you should do as you rise up is count.
Wishing you a fantastic Friday morning on the Now Morning Show. We, as always, give you items to add to your calendar. And this time around, it is in keeping with the previous conversation. We're talking health as the Santa Rosa Health Fair is on at the Santa Rosa Government Primary School on Sunday, the 24th of March from 9 a.m. to 2 p.m. To tell me more about it, we are joined by Dr. Jevon Rush, medical practitioner and an attached person to the Urology Department of the Arima General Hospital. Good morning and welcome, Dr. Rush.
Good morning. My pleasure to be here.
We certainly appreciate you coming through because we do need to know when these sorts of events are happening, particularly in the communities that people who may not be able to afford healthcare can reach. So tell me a little bit as to what inspired these sorts of drives, particularly in this case in collaboration with the SDHH.
Yeah, so definitely what we've realized is that healthcare isn't always the most accessible thing in Trinidad and Tobago, and it's several factors could influence that. Simple factors such as location, but factors such as finances as well. So what we're trying to do is really highlight the pathways into the public system that are available for the general public, right? The goal is really to make healthcare universal in Trinidad and Tobago. And besides making the healthcare universal, we want to have a high quality of healthcare that we're able to provide to the public simultaneously.
That is important because
Definitely.
we do know we have a lot of lifestyle diseases throughout Trinidad and Tobago. And so will there be particular diseases that will be focused on Sunday?
Yeah, so I would say yes and no. But so yes in regards where we're talking about specific diseases like prostate cancer and cervical cancer, as well as stroke and diabetes, but we're also taking a general approach. So we're targeting the non-communicable diseases, which are those lifestyle diseases you mentioned earlier. So things like the pressure, the cholesterol, even we're going to have eye assessments to sort out things like cataracts for persons. We really want to take a head-to-toe approach for the health fairs this time around. And again, that is to incorporate a large population as opposed to mitigating some of the people that could be involved.
That's a tall order, though. When you talk about head-to-toe, there's a lot that could go wrong.
Yeah, definitely.
So what sort of tests then are available specifically? You mentioned the cataracts. You said things like diabetes. So just the testing for it initially?
So what I would say is that the health fair is largely about screening. And when you talk about screening means we're trying to identify diseases at their earliest stages. And we're looking at the lifestyle diseases because the lifestyle diseases, they really form a foundation for developing a lot of the more complex diseases later on. So we're going to be, as I told you before, head-to-toe approach. So we're going to be doing things like stroke risk assessment, eye testing. We're also going to be doing lung function testing, breast examinations for the ladies. We're going to be doing pap smears for the ladies as well, prostate examinations for the men. And we're also going to be, we're not skipping out on the diabetics or the people with vein issues as well. We're going to be offering diabetic feet assessment as well as assessment for vascular disease or vein disease, right? Okay. But this health fair is really, yes, it's about providing screening, but it's also about informing the public about the medical information. So there are going to be several teaching sessions as well. So some things like basic life support, right? Basic life support, I think, is a tool that most individuals need to at least have a basic idea about because you never know when an emergency is going to happen, right? Thus the name an emergency.
Right.
So definitely it's going to be a very dynamic health fair and we plan to interact with the public on many different levels.
And the favorite level that they like is that it's free.
Yeah. So that's the best level.
Yeah, absolutely. But when we talk screening then, it means that there needs to be some level of follow-up.
Yeah, correct.
So how do we look forward to exploring that after the health fair itself?
So at the health fair, we're going to be taking your medical information and we're also going to be taking some of your demographic information. The patients that are candidates to actually be followed up in what you call a tertiary environment, meaning the hospital environment. So for example, as a man, if you come in and you do the prostate blood test and it's normal, then we'd allow the follow-up based on scheduling. But let's say you need urgent follow-up. Because North Central Regional Health Authority is a provider for this event, we'd actually be able to kind of siphon those persons into the tertiary healthcare system. And then the other persons that needs follow-up, we actually have a very well-designed platform that allows us to interact with those persons via email, via telephone as well. And the last caveat to this would be the fact that we are having these repeated health fairs, as you could see, right? This is like the third time you've seen me recently. So we want to keep that consistent interaction and consistent pace with our patrons of the public.
Not that we're complaining, because sometimes there's somebody who's not looking on before, they get in the message now. So this is great stuff. And granted that you're telling us that beyond the immediacy of the health fair, there will be follow-up, there is access, and even, as you said, siphoning them into the system. I'm sure there's somebody whose ears perked up and said, let me get organized to head down on Sunday. Now, in terms of the location, we know it's in the Santa Rosa, well, the Santa Rosa Health Fair is the title, but give me location specifics. How do we get there?
Well, it's for the Santa Cruz population, so it's at the Santa Rosa Government School, right? And we really looking forward for persons in the community to come forward and present themselves and try to make it less formal. And the reason I say that is because when you remove that barrier of that health professional interaction, you allow for a more friendly interaction with the doctors, and then that encourages persistent follow-up, and you actually engage the other person as well. So definitely we're looking for our Santa Cruz friends to come forward and participate with us this time around.
I'm glad you're saying it, family and friends, because it's exposing, or rather available to everyone, not just persons in the community. If you want to come down from a different district, that's fine, right?
If you want to come from Toko, Guayari, we welcome you.
Wherever you come
Wherever you want to come from.
One last question, because I'm sure there's a gentleman out there worried about that prostate test, or even the woman about the pap smears, which are usually quite private experiences.
Definitely.
So could you describe a little bit as to what these screening versions will be like?
Definitely. So with respect, I'll start with the ladies, because ladies first, right? The pap smear, the pap smear is really where we test the cervix, and the cervix is simply the mouth of the womb. Now, the cervix is liable to have changes in the types of cells, and those changes are a precursor or a step for developing cervical cancer. What the pap smear is an internal examination that allows us to take samples of the mouth of the womb and send it to the lab. The benefit of doing that type of test is not only are we able to detect cancerous cells, but we're also able to detect precancerous cells, right? So even though it's a certain amount of intimacy associated with the examination, the benefits definitely outweigh the disadvantages in that regard. And for the men, we have the prostate blood test, which is the PSA, or the prostate-specific antigen. And the men in this scenario have it a little bit easier, because they just have to start with a blood test, not really an internal examination. And that's not me showing favoritism, right? So what I would say to the men especially is, I know the traditional school of thought is you have to come and do that finger examination, right? But as technology progresses and time goes along, we're able to use the prostate blood test a lot more and actually reduce the amount of finger examinations that we have to do. So what I would say is, guys, come forward. Let's just start with the simple blood test. Once you're 40 years old, come forward. Let's do this blood test. Let's learn to know our numbers, and let's be proactive instead of in the treatment mode. As we know, and this may be a cliche, prevention is better than cure, but it's actually very factual.
I like that you glance across that, Rokas, when you're saying that. All right, we now know we're at this age. But in that case, I think we've got everything that we need to head on down to Santa Rosa. But anything else we need to know, we can, of course, head over to an Instagram, a Facebook, or maybe a website. And
we're going to be all over the national television. We're all over the Instagram and TikTok and that type of thing. And what I would say is, expect to see us very regularly. We want to keep you all interactive. We want to keep you guys with your ears perked. Yeah, so we really look forward to these type of interactions.
And we look forward to having you again, Dr. Rush, as you guys continue to create these incredible spaces for us to take care of our health. Thank you very much.
It's my pleasure and our pleasure.
Hopefully he gets some rest, and we will give you guys a break, because when we come back, even more on your jam-packed Friday edition of the Now Morning Show. Stick around.
You're surely best if you have life, ain't no guessing. Yo, I want you to hear me like the radio. Rise up is counting your blessings. Say, first thing you should do as you rise up is count your blessings.